commemoration is different in that we are not commemorating it in the traditional way, but virtually using the available technology. And this is in line with current pandemic that has besieged the world. These are some of the measures we are taking to ensure that we are responsive in terms of putting in place measures that are aimed at limiting public gatherings. So I want once again to thank all of you for tuning in, and thank you for participating in these proceedings. I will proceed to, at this point in time, call upon Dr. Robert Zulu, who is our Provincial Health Director for the Copperbelt Province, to give a word about working towards Zero TB initiative. Dr. Robert Zulu.
The Permanent Secretary, Ministry of Health, in charge of technical services, the WHO country representative.
People that are with Dr. Zulu, could you please mute and switch off your phones? Switch off. People that are with Dr. Zulu in the same room, switch off your phones so that we don't have feedback. Go on, Dr. Zulu. Thank you very much.
Thank you very much. The Permanent Secretary of Technical Services, the WHO country representative, the representative from the USA government. May I just protocol observed. What I'm trying to do is basically to share the Copperbelt Province initiative towards Zero TB. I'm trying to load again. The Copperbelt Province is one of the provinces that has a high burden of TB. The Copperbelt Province has a very high burden of TB. We are almost done. We are just starting the PowerPoint presentation. We will be done in about 5-10 minutes. If you look at the population of Copperbelt, you will see that we have about 2.6 million people, and we have two divisions, 10 districts, 3 rural and 7 urban districts. And the province has about 82 TB diagnostic facilities with 174 TB treatment facilities. Basically, we are a mining province, but TB tops our causes of death as one of the top 3 causes of death. And if you look at the province, you'll notice that we have made tremendous improvement in terms of meeting our targets. We have had challenges, but I'll start by presenting the TB case notifications versus the targets. If you look at the percentages, which is the gray line, you look at Kalulushi, Ndola, and Mufulira as the main districts that have made headways in terms of achieving our targets. We are around 71% as a province, but we are still lagging behind in the other districts. So we are targeting to look at the districts that we can call zero TB districts for the province. And that's the targets if you look at in terms of TB success rate. Mufulira, Dola, and Masaiti, including Pongwe, are making tremendous achievements in terms of meeting our TB success rate. As you know that the TB case notifications were revised, but what is important in this slide is to note that we are making headways in reaching our TB case notifications. Looking at the graph, you can see that we are making a steady rise in reaching our targets. The purpose of this presentation basically is to show all of us that it's possible to have islands of elimination or cities that are called TB-free zones. And we want to work with local government and business and civil society in the province with the same objective of making our cities what we call TB-free cities or TB-free islands. And would like these cities to focus on TB prevention, care, and prevention. And basically, in making cities TB free zones, we would like to make sure that we identify, support, and we join hands with our local consortia to fight TB and drive our focus in the reduction of TB death and in making sure that we prevent TB. We will mobilize and complement financial support and technical support from the clinical and the technical areas to make sure that we reach our targets. The efforts that we are making in reaching our targets is that we want to create provincial TB elimination committee, which we've done by creating a TB elimination committee. We will also have mechanisms to monitor and implement TB elimination. This basically is focused at making sure that we've got what is called the zero TB cities. We have already deployed the one-stop mobile TB truck, which has a digital X-ray and gene expert machine. This truck was launched about 2 weeks ago. The goodness with this truck is that it's got the lab and the X-ray facilities in the same facilities, and it can be moved from one city to the other city. And our target basically is to have routine tracing and monthly active TB case finding, and making sure that we've got intensified case findings. We want also to target our prisons at Kamfinsa and in Kansenshi prisons, so that when the prisoners enter the prisons, we have assessment and screening for them. And when they are leaving the prisons, they also have a screening point, so that they will make sure that they are going back to the community without TB. We've zoned already about 6 zones for the province. In zoning, we would like to focus on mentoring, district coordinators in making sure that they focus in making sure that their cities achieve what is called the TB-free zones. We've also engaged our private health facilities and our private pharmacies to make sure that they also towards facilitating the implementation of what we call TB-free cities. Our success basically are many, but I will point out the areas that are important here. We've made tremendous improvement in the TB outcome, treatment outcome. as you can see from the previous presentation, that there's been a steady rise in the follow-up. We've reduced the loss to follow-up, and we've got a high TB HIV uptake, and our HIV TB has maintained quite high. And in fact, our TB prevention strategy is working very well. The challenges that I want to cite basically to do with sustaining a high death rate. We've remained at 4 to 5% on the TB death. And the other challenge is basically in the pediatric TB. We still have problems in making sure that we make diagnosis in the pediatric age group for TB. And the low index of suspicion for TB for both susceptible and the DRTB amongst the healthcare workers. The general low healthcare worker capability of making diagnosis in TB, particularly in children, has remained quite low. Thank you, PS.
That the Copperbelt province has a very high burden in this country. And the more we put in efforts to address that problem, the better for the entire population of the country. We will move on to the Western Province. Western Province, are we there? We would like to invite professional who suffered from TB and is now cured and back to work, just to listen to that testimony. Western Province, are we there?
Sister, Mr. Njamba, are you ready?
Morning. Good morning.
Can you
Good morning, thank you. Please proceed with your testimony. Start by introducing yourself. Thank you.
My name is Sister Rufunda Namunji, a nurse at Lewanika General Hospital. My story occurred when I was in service for about 3 years. In 2003, I used to have frequent flus and coughs at night, which never responded to antibiotic treatment for almost a month. The doctor who was looking after me requested a chest X-ray and sputum for AFD, which tested positive 1+. I was immediately commenced on treatment for 2 months, which was intense phase, and 8 months continuation phase. I was confused, wondered why it was me who had to have TB out of everybody. People wait for so many years without having TB. I received the support from the counselors who counseled me throughout, staff, and the doctor who attended me, and my fellow sisters. But some of my friends were afraid to associate with me because they were scared that they will have TB. Because of what I went through, I was also encouraged to eat well-balanced diet. What I went through, I appreciate it today because I've helped so many people since then. And it helps me to understand the patients, what they go through when they are on treatment. And TB is a curable disease. And since then, I have been well because of my adherence to treatment. And I encourage everyone who is on TB to adhere to treatment and have a good diet, and they'll be well. And I've been working in the Ministry of Health since then. I'm very happy and grateful for this new program of TB screening because patients will be detected and identified early. And I'm also grateful to the Ministry of Health because they have improved the treatment of TB, and they are able to identify complicated cases. Thank you.
Mr. Mfunda, thank you very much.
Thank you.
We commend you, Sister Mfunda, for sharing with us your experience. I think it is very important, particularly coming from a health worker, really underscoring the fact that TB does not spare anyone. And all of us need to be conscious of this fact and take all the precautionary measures to ensure that we prevent it. May I just check whether our colleagues from CDC are with us? Is Dr. Agolori online? Okay, so I will proceed.
Dr. Supremacy, just to say that Dr. Golori does intend to join. In the meantime, I'm logged into the call.
Okay, thank you so much. Thank you. I'm advised that we do have another testimony, and we'll just cross over to the next testimony.
My name is and I'm the focus on person. I'm glad to have been able to share my story. The year 2003, 15 years ago, I suffered from TB. I was first diagnosed with pneumonia, out of which I received 5 days. I made some improvements discharged from the hospital, but in particular UTA. Despite having completed the course of the chest pains, the pneumonia chest pains. 2 months later, my condition worsened, and I started having night sweats and having excessive vomiting. At that point, nothing that worked out. I then went to the hospital, back to UTA. And based on the symptoms that the doctor asked me to submit because he thought that I had TB. The chest X-ray was also done. I did my 3 days taking. Those days that take the hospital. When I got back my results, I found that I had TB. It was then that after the diagnosis, my heart broke. I lost all hope, and I thought I was dying at that point. Luckily, I contacted my mother, who's been praying from conception. I wanted that to help me make a decision. Not only to make a decision, but share the burden. 2003, not common, and many stories. I was very reluctant to start my medication, but my mother told me one thing. She asked me to remember her. She reminded me of her friends. She said to me, my son, look at my friends. He injects herself with insulin daily for the rest of it. But for you, it is only TB, and 8 months you will complete and get cured. The first time I heard someone talk about that was my mom. For me, that was a dead. I accepted and started treatment such that by month 2, after the intensive phase of treatment, I was back feeling so much better. I thought it was complete. At that point, we did not have support force of individuals. On my own, I thought maybe it is time to stop because I'm feeling good. But the nurses encouraged me to continue 8 months. I hope my experience will help you to get cured. Here I am, 17 years later, and still. I would like to assure all of you, my brothers and sisters, I'd like to commend the government and all stakeholders for the efforts they are putting in the fight against TB, and in particular, TB preventive therapy. TB is not only curable, sadly, it is also prevented.
Thank you very much for sharing that testimony with us. Indeed, I believe it does encourage somebody out there, and calling upon all of us not to stigmatize those that suffer from TB. We also commend the many efforts that the government is putting in place to ensure that we reach everyone that needs to be reached with services TB. Allow me at this point in time, ladies and gentlemen, to just call upon our World Health Organization country representative, Zambia, Dr. Nathan Kaita, who is going to, at this point, give his remarks. Dr. Nathan.
I'm pleased to appreciate because we all action Zambia thing time for TB-free communities. It's an opportunity to realize how crucial community-based TB interventions are. Finding the missing parts of the TB address the education gap and improve treatment adherence. Although the African region is making progress, we are not on track to achieve 30% related to TB. There continues to be more TB cases in the African region than in any other country. Only 1 in 2 people with TB, that is around 6% across the continent, fewer than 1 in 3 children, and someone with confirmed active TB therapy. So budgets are funded. Most countries do not have information on families that are facing catastrophic costs. This is needed to track progress towards SDG targets. Ladies and gentlemen, more than 1/3 of people estimated to have TB are either not or if they are weak, are not being reported. Even in patients who are identified, TB is often diagnosed and treated. Challenge, particularly in high burden countries than the rest. So building on the gains we have collectively made, it's now time for bold action to achieve our targets. It is time for the government to improve domestic investment in TB and to strengthen the environment to facilitate monitoring and use of the quality. It is time for healthcare providers to implement minimum standards of care in kindly recommended treatment, regimens, and preventive therapy. It is time for the government has required broader action beyond the health. Okay. Other ministries, parliamentarians, community leaders, researchers, academic institutions, patient advocacy groups, and people affected by TB. I'm so glad that we have those testing, one from 9 months like Nathan, for people to know that it's possible to get TB, the diagnosed, treated, and sure that we tell the story. I think we have a greater community so that we can bring everybody on board to ensure that we get rid of this. Multi-sectoral action is needed to ensure access to services. Civil society organization and community systems strengthen to provide diagnostic support and care where the patients live and work, as well as facilitate access to services and to assist governments in scaling up services. I appeal to the government and follow continue to implement a health law policy framework, promote a multi-sector engagement so that all sectors are mobilized. It's time for the government and partners to work together addressing these factors for TB, such as overcrowded living environments, high-risk occupations such as mining and workers, and comorbidities such as HIV, diabetes, and malnutrition. Ultimately, to end epidemics of TB and other diseases, strong health systems as the bedrock by the University of Africa. I reaffirm my office, the UN family and all partners, working government and communities support the above action. For Zambia, be free of TB, work together to bring diagnostics, treatment, and follow up closer to communities, ensuring that no one, and I think all of us had or listened to the provincial director innovation they have about mobile. Those are the sort of innovations that help us design the and to support this work, yes, I hereby make a hand of symbolically 850 boxes of experts MTV test kits containing 42,500 cartridges valued at $400.
Thank you very much, Dr. Bachaita, Country Director or Country Representative for the World Health Organization, Zambia. Ladies and gentlemen, before we proceed to listening to the keynote for this morning's commemoration, allow me to ask our technical staff just to play us a video on sensitization around TB awareness, and this focusing on our traditional leadership around the country.
Do you know that anyone can get Do you know that anyone can get
eyo kala mtu naase kukwatya omusonga wa TB
omuntu yense okoresha okwatwa na kintu
nei unavuzvino kamuchima nei uri na musonga wenewo wanchuluhera wa TB watera kwaswaswai katera kuna kubuyire nokumashama
amuke kuchibhadhera iri munhu awiriwe kumubhedhewo ngabo munobwakakwe
Hai vamwe muhakuri mnani kutuku wa mwini ambone kumashaka sipata wakumika kaita kusa yani mchipata mwini mkaze kati mna mapenda ya TB
yenu kuchipatera chipaka mwina ye nemurafera mwenu ya TB
mwakwana kuyenda kupembera kipatera kijipa wipi na komwe kara ngi mwamuna kubamba kampe bikino chikora wipi yanu
utukira kuchipatara kamara
kandi mpinji rekumarisha lokale musonga wejima wa muntu wa TB ni plate yejima inani natihani na neno hamu satira hamu kinabo yakulwaniza butuku wa mwili donati nani ke mwando wa mo
mushitatu kuzo kumono emo indi yakuba ejinaga kwewe natola ruwa
ikimye yakutara umanyawunda kasuka yamua monka mkwisha.
On 24th March, Zambia joins the rest of the world in commemorating World TB Day 2020. It's time for TB-free community. Be involved.
This message is brought to you by the Ministry of Health with support from the Southern Africa Tuberculosis and Health System Support Project.
Well, thank you very much for that very important message from our traditional leaders. Three main messages being communicated there. The first one being that anyone can suffer from TB. Number two, if you suspect that you have TB, go to your nearest health facility. And finally, which is the theme for our commemoration today, it is time for TB-free communities, and each one of us needs to be. It is now my singular honor and privilege, ladies and gentlemen, to call upon our Permanent Secretary, Technical Services in the Ministry of Health, Dr. Kennedy Malama, to deliver his keynote address.
Thank you very much. Let me start by recognizing out of and to the left. So it's nice to have you. Let me also recognize the presence of our Director General, numbered Executive Officer, directors from the Ministry of Health, others, senior medical superintendents,
district health directors present, all staff from the various United Nations. I also recognize the presence of cooperative partners, and the Health Association of Zambia, and all the facilities, all the healthcare workers, both public and private health, do a commendable job. And I also recognize civil society organizations and government organizations, including community-based organizations. I recognize the presence of the members of the press, and may I simply say, distinguished ladies and gentlemen, we meet today in the midst of COVID-19 outbreak as a pandemic. Important that as globally, regionally, and also as a country, as we mount an effective response against COVID-19, don't lose track of certain public health threats in our country. Therefore, it's important that we don't forget about tuberculosis. We need to ensure that we continue reminding ourselves where we are coming from, where we are, and where we want to go. Prevention and control. Distinguished ladies and gentlemen, today Zambia joins the rest of the world in this virtual interaction we're having, commemorating our TB. Under the theme, time for TB free community. Very clear that this theme is challenging all of us at individual level, family level, community level, and indeed as a nation. Take stock of work and be proactive, make it, and ensure our communities are free of TB. As we commemorate this day today, let us stand in solidarity and with resilience in the fight against the two airborne diseases, COVID-19. In other words, that the transmission of COVID-19 need to ensure that this day should also remind us that people with TB are vulnerable to COVID-19, and we should ensure that access to TB prevention, diagnosis, and treatment continue. Thank you. Ladies and gentlemen, I'm pleased to share with you that as a country, we are making tremendous progress in the fight against TB. For this reason, that we should not relent as a country. For instance, in the month of February this year, the World Health Organization conducted an independent review of our TB program to assess the progress that Zambia is making in the fight against TB. It is gratifying to note that the findings of the independent review of our program point to the fact that Zambia is on course of achieving the United Nations high level. As it has been alluded to by WR, this calls for concerted effort by all of us at all levels, starting from the community, the highest level, in terms of service level. We also take note of the progress that we are making in reducing the TB incidence and TB death. Over the last 2 decades, Zambia has reduced the TB incidence and mortality rates by 54% and 56% respectively. But remember that. Further, as a country, we made exponential progress in TB preventive therapy. In 2019 alone, over 110,000 people living with HIV were commenced on TB prevention therapy, surpassing the performance of 2017 and 2020 combined. Whereas this progress is commendable, as I have alluded to earlier, we need to remember that is distinguished ladies and gentlemen, while we've made significant progress in our response to TB epidemic, a lot remains to be done. Today, TB remains one of the leading causes of death and death in our country. Let me share with you that TB remains a disease of global health concern. For this reason, that countries across the globe have come together today to reflect and renew their efforts in the response to this epidemic. Ladies and gentlemen, the government of the Republic of Zambia, under the leadership of His Excellency Edgar has prioritized prevention, control, and management of tuberculosis. And for Zambia, the focus is on collaborative efforts as we mount a response to TB, similar response being mounted to TB, HIV collaborative effort. Government's commitment to the fight against TB is evident through several policy directions and actions which we provided over the years and will continue. The country rep for World Health Organization stressed the importance of multi-sectorality. As you are aware, in Zambia, we did launch the health inoculum. So that is the foundation for our multi-sectoral engagement. That for I just to assure you. The issue of domestic financing is prime to us, and will continue delivering on government of the Republic of Zambia's provision, but also more importantly, working with various cooperative partners so that we can provide sound financing, particularly for health system strengthening and prevention and control. In addition, government continues to hire and recruit new staff that are strategically deployed at primary health care level, where most of our people face sick. I will need to go into the numbers. Here, that from 2017 to date, 22,000 health workers against our target of 10,000 by and the majority of these health workers are saving, including. Ladies and gentlemen, as a sign of our commitment in this response, I'm pleased to share with you that for many years, we have not experienced any stock-up of anti-TB medicine. And this is mainly because the government of the Republic of Zambia has worked very closely with cooperative partners, and we were sure better than ladies and gentlemen, limited awareness about TB and stigma the disease are the principal factors that are hampering government efforts in preventing, finding, and treating TB. Therefore, activities for this year's World TB Day are enlisting everyone to get involved are high impact, and all of us need to ensure that we support this. From this front, that we call upon various stakeholders, non-government organizations, civil society organizations, leaders, traditional leaders, to ramp on the efforts we commenced to ensure that we go back and ensure that our people enjoy the highest level of health. This way, we are also assured that the population will equally get involved as they will be inspired by our leaders. We have good lessons to learn from the global and national response to the coronavirus pandemic, even as we mount this response. I repeat, let's ensure routine service times when you are faced with the challenge, pandemic of this magnitude at all levels, our attention may be divided, and we may end up with conditions such as measles, polio being forgotten. That's why it's important for us to focus on the even amid this pandemic. Distinguished ladies and gentlemen, let me also mention that as a country, we are aware that multi-drug resistance TB continue to pose a threat to our control. I give you assurance of government and the Minister of Health that we continue investing heavily in fight case finding, diagnosis, treatment, and ensuring availability of efficacious drugs, including drug resistance. We are at a time when there's so much technology in the space, which is enabling us to look after our people better than we did in the past. As I conclude, let me extend special appreciation to all healthcare workers countrywide for their unwavering effort, support, and the work we continue to put in preventing, diagnosing, treating, all the progress we've made. The first accolade, they go to the health work. We are serving in various parts of the remote and rural parts. Let me also extend appreciation to our cooperating partners, particularly the United States government, through USAID, CDC, and many other also government fight Global Fund to fight HIV and AIDS, tuberculosis, and malaria. They've also been very instrumental. The UN system, particularly World Health Organization, remain indebted for this great partnership. Today we just witnessed donation that has been given through the Russian support, through the WHO, government of the Republic of Zambia, Minister of Health, cartridges, facilitate work using the platform. That's an we appreciate and take the message back that this will go a long way improving the platform. Let me also commend the World Bank. The World Bank has been very, very catalytic in our work. At the moment, we are implementing one of our biggest projects, Southern African tuberculosis and the World Bank. Civil society organizations, various non-government organizations, have always been supporting the line ministries. Yes, in the spirit of plurality, starts within government, in the spirit of government approach and rural society approach, and line ministries. And the ordinary family, the program in particular, has received a lot of support from ordinary people. Now, best we can make a difference as we look at TB. I would like also to call upon all of us, individual level, family level, community level, and indeed as a country, to embrace this testing that seeks to enhance our TB. Let me call upon all of us at all levels to get involved in the scaling of TB prevention. It's a game changer for us. TBT is a high impact intervention. We need to ensure that we roll out to all parts of the country and ensure that our people who are able to access this life-saving intervention. We need to invest in active case finding, improving the quality of care for our people. For our healthcare workers, let's prioritize quality data. There is quality data in our because that is what is going to equip us with ammunition to make collective allow me to have time for TB be involved. Be involved at individual level, family level, community level, and that's when we can. In addition, stay free of COVID. COVID-19 today poses a big threat. We appeal to all Zambians to adhere to the guidelines, the instructions, guidance given so that we protect ourselves. This my honor this morning to launch World Zambia using the nature platform. I think this has given us an opportunity to think that there is no hope. We don't need technology to deliver the same. All those who are connected in health directors in particular, we value your contribution. We expect you to move this social movement process by one of the key performance indicators we shall use to judge your provinces, uptake, and effective implementation.
Indeed, thank you very much, PS, for those very inspiring words. I believe the message is very loud and clear on this 2020 World TB Day commemoration. The fact that it is time for free TB communities, TB-free communities, and all of us must be involved. As we are about to conclude, I will now call upon Provincial Health Director for Lusaka Province, Dr. Constantine Mwale, just to give us a vote of thanks in thanking the keynote address from the Permanent Secretary. Dr. Mwale, over to you. Kindly unmute your mic, Dr. Mwale.
Okay.
Thank you so much.
Okay. Thank you. Please, my apologies. You can see that I was born before computers if you look at my forehead. So I want to start by recognizing the presence of our Permanent Secretary for Technical Services and the dignitaries, the NAC Director, the CDC representative, and also the World Health representative, country representative. I also want to recognize the directors from the Ministry of Health and colleagues from across the country. May I simply say all protocols observed. Indeed, as Lusaka Province, it is a rare honor and rare opportunity for us to give a vote of thanks. And for that, we would like to start by thanking the leadership in the Ministry of Health, the leadership in the multi-sector response towards TB elimination, and all the colleagues that have spared their time off their busy schedule to be part of this innovative virtual World TB commemoration amidst the various commitments. Among them, our day-to-day 24/7 response towards COVID-19. As a host province, we too are faced with a huge burden of TB. And let me take this opportunity to share that we are equally committed in this fight of elimination of tuberculosis in our province and the country at large. May I also take this opportunity to express our sincere gratitude to the various partners that support the TB elimination in Zambia. Among them, CDC Zambia through PEPFAR support, the Global Fund support, the World Bank support, the Japanese support, NAC, CHARS, to mention but a few. The support towards TB elimination will certainly give us our desired goal by the year 2030. This year's theme, as indicated and highlighted in the keynote speech, is in line with our aspirations as a province in our quest to eliminate TB, as it calls on everyone to get involved. Lastly, allow me to recognize the TB and leprosy program leadership for coordinating this important commemoration, as well as the events, the clinical screening that we undertook prior to this day. We thank you, and we remain committed to ending TB. Yes, together we can conquer TB. I thank you all.
Well, thank you so much, Dr. Mwale. We will have a short question and answer session. The PS is available to respond to a few questions from all of us across the country. So if we have any points of discussion, any questions, please let's raise them for now. We'll be able to take a few. Limulunga, Mr. Msimuko, any comment from there? Limulunga, I would like to hear your voice.
Thank you, Director of Public Health. We are glad that we managed to link in and be able to listen to the speech of the Permanent Secretary as an initial free of TB, and the speech has inspired us even to do more. Currently we are on the ground doing active case detection as part of the activism week, and we are doing the contact tracing. We want to believe that these efforts will help us to identify all those that are infected with TB. So now, I think we do not really have questions, but rather we are listening to the guidance that you are providing. We are thankful for the inspiration that you are giving us from that end. Thank you, sir.
Well, thank you so much. Would we have another comment or question? Allow me to ask the PS to make a comment.
Thank you very much. Again, just to commend our two colleagues who gave testimonies. For sometimes we discuss diseases as diseases, and yet they are human beings, those numbers. Just to commend Sister Kura and also Brother Jari for that sharing. I think commend you. Many people are still thinking whether they can come out and share, influence the lives of other people. So we commend you. And Mulunga, thank you very much for being shy. I don't think you don't have any questions, but you are still thinking about it. We are aware of all the challenges in our district. We assure you of transport, we are looking at those on how we can enhance your work in all the districts. We know the issue of funding has been a challenge this year, but we are engaging our colleagues in finance to see how your plans for running costs can be. Our key message is that whatever resources you are receiving from partners, we need to manage those resources well and apply them to strengthen systems. That even beyond the support of those projects, the system can remain and improving service. So, Director of Ceremony, for me and my colleagues here, It's just to thank all those who connected in this wonderful interaction, and we are sure that we continue using such platforms. And I'm sure in the next interaction, questions, clarifications, line.
Thank you so much, PS. There is a question from Vugui. Perhaps we'll take that one question and then we'll be concluding our session. Vugui, you are on.
Good morning. Morning, team. Thank you very much for giving me this chance to comment. I'm impressed with the speech given by the PS. And the question I wanted to ask, or the comment I want to give, has already been given by the former speaker. Thank you very much.
Thank you very much, Bobwe. We are glad that we have heard your voice at least.
The director of sales was Absolute.
Yes,
we know you very well. Yeah, we know you very well. You are a champion in the TV controls the country. We see your footsteps in the Chama district. Now you are in Bob. We continue the fight at Bob. We're also just being shy. I know you have a lot of questions, but enough for the next day.
Thank you.
Well, thank you very much to everyone for having connected in. The take-home message is it is time for TB-free communities, and all of us need to get involved. I will ask all of us from everywhere just to wave as we come to the close of this session. Thank you. We'll see you next time.